I'm Dr. Beth Oreo, pelvic floor physical therapist. Today we're going to be going over a technique to relax the back, the pelvis, the pelvic muscles, everything, and just kind of calm the nervous system down. So this is a great technique to use if you have pelvic pain, low back pain, feeling of muscle tightness, tension. Basically, we're using the principle of oscillation. The nervous system likes oscillation, like shaking, little shaking movements. It's very calming and relaxing to the nervous system. This is why we rock a crying baby. This is why we like rockers, like to be in a rocking chair. It's why we like swings. Our nervous system likes that kind of movement. So you can use this kind of movement to decrease pain and to just get the muscles to relax a little bit. So we're going to show, we're going to do two movements, and if you have concerns for maybe you've had a spinal surgery, maybe you've had a hip surgery or something, and you have specific concerns about whether or not you should do this, then speak to your physical therapist who treated you for those problems, or speak to the surgeon, the orthopedist, and get some advice on whether or not this would be safe for you. But it's generally safe. It's really hard to hurt yourself with it unless you do it aggressively and do it wrong. So if you follow these instructions, you should be fine. So basically, you're going to start laying down on your stomach. If you can't lay on your stomach comfortably, then just stop here. And again, you need individualized instruction on how to accomplish this same kind of technique, maybe in a modified position or a different position altogether. All right, so we're going to start on our stomach. Okay, and I'm going to rest my head on my forehead on my hands, like this. Now I'm going to keep my head up while I demonstrate because it's easier for you to hear. If I speak into the bed, you won't be able to pick up my voice. So, but when you're doing it, this position, okay? Now, if you have trouble with your shoulders, you could put a rolled up towel here, like that, and you could relax your arms back like that, okay? But it's important that the muscles be relaxed, okay? So what you're gonna do is you're gonna bend your knees up and have your knees a little bit close together. We don't want them way out like this. So we want them kind of right in line with your legs. And put your feet together. And now what you're going to do is you're just going to gently let your legs swing, very gently and loosely. You're not doing this fast. You're not trying to force your legs down. You're just loosely letting them go. And the whole purpose of this is to let go. Let your muscles relax. Work into it easy. If you're having a lot of pain, just go nice and slow. Okay, you're not holding it. You're not coming over here and trying to stretch it down and force it down. You're just going back and forth very gently. Okay? Just nice and loose. And I'm just kind of like sliding one foot down the leg of the other and just going back and forth. I'm letting my pelvis go with my legs. So I'm not trying to hold my pelvis down, push it down into the bed. I'm just loose and relaxed. Okay, if you feel pain anywhere, you should go a little slower. Don't go as far. Just kind of go like this and see how it feels and work into it. Usually if you're having pain, it's going to be more like a muscle guarding. So you want to try and loosen it nice and relaxed. Okay? The second technique is to just crisscross. And just let the legs go back and forth, crossing in the center, going wide, crossing in the center, going wide, and just loosening things up. We're just moving within a comfortable range of motion. We are not trying to go to end range. We're not trying to go as far as we can. We're not trying to force anything. It's nice and loose. We want nice, loose, easy movement. It's very relaxing and calming. It's good to do if you're having, feeling very stressed, you're having pelvic tension. You can put on some nice music, something that's calming, and just try and relax those muscles a little bit. So those are two easy techniques for just improving pelvic mobility in a nice, gentle, oscillatory manner. And so I hope you found that helpful, and hope to see you in another video.